Hi, I am CEPHALOSPORINS. My brand name is CEPHZIL. My drug classification is I am a second-generation cephalosporin. Then my therapeutic classification is I am a antibiotic. My pregnancy category is category B. My mechanism of action is that I am a semisynthetic second-generation cephalosporin. So I am used to treat otitis media, soft tissue infection, as well as respiratory tract infection. So I have a antibiotic action in which I interferes with bacterial cell wall synthesis during cell replication, in which I inhibit the third and last stage of bacterial cell wall synthesis, leading to osmotic instability and cell lysis. So my action is either bactericidal or bacteriostatic depending on the concentration. My pharmacokinetics is that I am absorbed from the GI tract about 95%. Then my distribution is protein bound about 36%. Then probably I'm metabolized by the liver with plasma half-life increases only slightly in patients with impaired hepatic function. So, about 60% of my dose is recovered unchanged in the urine. So, plasma half-life is 1 1/3 hours in patients with normal renal function and 2 hours with impaired hepatic function, while 5 1/4 to 6 hours with end-stage renal disease. So, I am removed by hemodialysis.
Hi, I'm CEPHALOSPORINS and I am indicated in a treatment for patients who have infections in respiratory, skin, soft tissue, UTI, ENT that is caused by Streptococcus pneumonia, Haemophilus influenza, Staphylococci, Streptococcus pyogenes. It could be Group A, beta hemolytic streptococci, E. coli, Proteus mirabilis, Klebsiella, and coagulase negative Staphylococcus. And I am contraindicated to patients who are hypersensitive to drug or other cephalosporins. Used cautiously in breastfeeding women and patients with impaired renal or penicillin allergy. My side effects and adverse effects is that patient will experience dizziness, headache, lethargy, and paresthesia in central nervous system. And we have diarrhea, nausea, vomiting, abdominal pain, anorexia, and flatulence in GI tract. Genital pruritus, vaginitis in genital and urinary system. We have nephrotoxicity who have predisposing renal insufficiency in renal system. Then eosinophilia in hematologic, and rash, urticaria, diaper rash in the skin. Other side effects and adverse effects, we have superinfection, hypersensitivity reactions like serum sickness and anaphylaxis. I will also affect the lab results of the patient, like the increase of the BUN, the blood urine nitrogen test, the creatinine, the alanine aminotransferase test, aspartate aminotransferase test, alkaline phosphatase, bilirubin, and LDH levels. It will also increase eosinophil count, may decrease WBC, leukocyte, and platelet counts. Nursing responsibilities in administering CEPHALOSPORINS. Before administering the drug, assess for contraindications and cautions before administering the drug, such as the history of the allergy to the drugs, pregnancy and lactation status in women, and severe renal and hepatic dysfunction, which are contraindicated in using of the drug. Perform a physical assessment to establish baseline data before administering the drug therapy and to evaluate the effectiveness and potential adverse effects during therapy. Examine the skin for any rash or lesions and examine injection sites for abscess formation, and take note for the respiratory status of the patient. Perform culture and sensitivity tests at the site of infection to ensure appropriate use of drugs. Assess for the nutritional intake and note any problems with intake and adherence to prescribed diet. It is to help prevent the adverse effects to the therapy. And then check renal function test results, including blood urea nitrogen or the BUN and creatinine clearance. During administration of the drug, check culture and sensitivity reports to ensure that the drug is for the patient. Monitor renal function test values before and during therapy. Ensure that the patients receive the full course of the cephalosporin as prescribed. Monitor the infection site and presenting signs and symptoms. Provide small frequent meals as tolerated as well as adequate fluids. Monitor injection sites regularly to provide warm compressed and gentle massage. Instruct the patient about appropriate dosage, schedule, and possible side effects. Educate the patient about the drug that is administered and the warning signs to report and the family as well. After administering the drug, monitor patient response to the drug therapy. Monitor for the adverse effects like the orientation and effects, renal toxicity, hepatic dysfunction, GI effects, and irritation including phlebitis at injection sites. Provide comfort measures to help the patient cope with the drug therapy and evaluate effectiveness of the teaching plan to the patient.